So a lot of people who want to have their short-sightedness and astigmatism and presbyopia corrected and who are under the age of 50, they often ask whether they should be doing LASIK or the implantable contact lens, otherwise also called ICL. Well, I think that if your corneas are well thick enough, yes, LASIK is certainly a consideration. And the moment your corneas are too thin, then immediately you don't satisfy the criteria for LASIK if it's thinner than 500 microns, and you would have to consider alternative non-laser based vision correction such as the implantable contact lens ICL. So today we're going to talk about the ICL, who are the suitable patients for implantable contact lens surgery, the pros and cons of ICL, the risks involved with this surgery, the safety, as well as the post-operative vision recovery. So this is what the ICL looks like, and it is made of Collamer material, a very foldable material. And the main company that makes ICL is STAAR, S-T-A-A-R, from Switzerland. And in our clinic, Dr Natasha Lim Eye Centre, we would only use STAAR Surgical Evo ICL. There is another company based in India which also makes ICL. When you do consider ICL surgery, of course you would inquire about the price, and from a price point, it is approximately $1,000 more than laser vision correction per eye. So it is a more expensive option. For laser vision correction, they would normally correct up to minus 10 degrees, or in Singapore, people call it minus 1000 degree because it's minus 10.00 of short-sightedness. However, for the Evo ICL, it can correct up to minus 24.0, or in Singapore, we call it minus 2400 degrees. It can correct up to minus 600 degrees of astigmatism, and it can correct any amount of presbyopia because we will arrange a way of programming presbyopia correction by doing monovision. So it corrects up to minus 2400 degrees of myopia, minus 600 degrees of astigmatism, and any amounts of presbyopia. Laser vision correction requires a minimum 500 microns of cornea tissue, but there will be at least 5 to 10% of the population whose tissues are thinner than minus 500 microns, and if they still want a vision correction, then they will have to consider the ICL. ICL, as you can imagine, you will have to fit this surgically implanted contact lens into the eye. Therefore, the eye needs to have sufficient volume or sufficient space. So there is also a criteria for you to fulfill if you want to be the suitable ICL candidate, and that is your anterior chamber volume has to be more than 2.8 millimeters cubic volume. So if you don't satisfy that, then you cannot do ICL, and you may have to consider other forms of laser vision correction such as the PRK. So a lot of people, if they were to be seriously considering the ICLs, then they would inquire about what the surgery entails. First of all, you would have not been drinking or eating by mouth for 4 hours prior to the operation, i.e. you would be starved. And at the time of your surgery, you would obviously lie down on the operating theater bed, and we will numb your eyes with some numbing eye drops. And when the eyes are well numbed enough, we will proceed by simply making a 2 millimeter opening at the corner of your eye. And the Collamer material is foldable, so we would roll this ICL up until it's in the shape of a spring roll that is less in diameter than 2 millimeters, and we'll simply inject it into the eye. Once it's in the eye, it will unfold itself open, and it will stay behind your iris muscle, but in front of your natural crystalline lens for the rest of your life until the day you develop a cataract. The ICL is actually customized for you by us measuring the height of your eyeball, the length of your eyeball, the curvature of your corneas, and then giving all these data to Star Surgical, and they would customize a lens whose size is supposed to fit nicely so that once it's inside the eye, it mustn't be too big or too small. The fits should be just perfect in order that post-operatively you may undergo most vigorous sporting activities, and if the size is just right, the ICL wouldn't move within the eye at all. And the surgery just barely takes 10 minutes per eye. There is no sedation involved, and because of that, you will regain your vision within 5 to 6 hours of that same operational day. And the next day, you can see very clearly. You would simply need to use antibiotics and anti-inflammatory eye drops at a frequency of 4 times a day for only 2 weeks, after which you may discontinue these drops. In this 2 weeks, the only activity you have to refrain from would be swimming, but all other daily activities can resume on the second day, which means that you may wash your hair and face, and soap and shampoo can enter the eye. You may do light lens spots such as gym and jogging the next day. So what are the advantages that ICL has over LASIK, in order that some of our patients, even with very thick corneas, would elect to go for ICL surgery and not for LASIK? The main advantage that the ICL has over the LASIK is that because it enters the eye through a tiny cut of 2 millimeters, there involves no corneal burning, no corneal flap cutting, and therefore ICL surgery does not give one any permanent dry eyes, whereas laser vision correction will give you some post-operative dry eyes. The ICL, by not involving the cornea, not shaving the cornea thin and not cutting any flaps, will not at all affect the long-term strength and stability of the cornea. And the ICL, most of all, is advantageous in the fact that it is any point in your life reversible. Be it 3 years or 30 years later, the ICL is easily removed from the eye. And I said earlier that it should be expected to stay in the eye until the day you develop a cataract. When you develop a cataract, it means that the natural lens inside your eye, approximately around the age of 60, turns cloudy, and you will start to complain of blurred vision for far and for reading. And at the same time of your cataract surgery in your 60s or in your 70s, not only would the cataract surgeon then remove your cataract, he or she would also remove the ICL that was implanted 20, 30 or 40 years back. And then they will be replaced with a different type of lens implant that is to replace cataracts. So the mileage you can get from your investment in ICL surgery would normally be anywhere between 20 to 40 years. So how much does ICL surgery cost? At our eye clinic, Dr. Natasha Lim Eye Centre, the approximate price is starting from $3,200 up to $4,200, because the more complicated your degree or power is, i.e. the higher your short-sightedness, the higher your astigmatism, then Star Surgical would cost more to create this lens for you. But normally the price range per eye is between $3,200 to $4,200, thereabouts. And what is the safety with ICL? It has a safety record of 99% success rate and has been around since 1990. And when we talk about the possible 1% rate of complication, it really does not mean loss of vision, other than sometimes, despite very detailed measurements of the length and size of your ICL, occasionally, once it's gone into the eye, then it can still be regarded and deemed as too big or too small. So we will always say that there's a 1% chance. You may have to resize the lens. That means removal, going back in with another size that is one size up or one size down in the event the size does not fit perfectly. And that chance is really less than 1% of the time. So I hope that answers any of the questions that you may have regarding ICL. It is a very trustworthy procedure in the hands of a right surgeon, and it is definitely an alternative to laser vision correction for many, and the refractive surgery of choice for people with dry eyes or people with thin corneas. Thank you.